Hi, I'm Susan Taylor with Scripps Health in San Diego, California. Please subscribe to our Scripps Health YouTube channel. We've got great information for you featuring the latest technology, our stellar doctors, and inspiring patient stories. Stressed? Okay, who isn't these days? You're racing to get a project done at work. You're rushing to pick up your kids at school and take them to soccer or dance class. You're stuck in traffic and you're going to be late for an important meeting. Are you stressed right now? Type yes in the comments section below and let us know what's causing your stress. Everybody has stress, and a little bit of stress can actually be a good thing. But you've also heard the saying, stress kills. Here to talk about how to handle stress is Dr. Stacie Lee, who's an internist at Scripps Coastal Medical Center in Carlsbad, California. Thanks so much for being with us, Dr. Lee. So everybody has stress, right? That's a given. I mean, how would you define stress? You have a full-time job, you have 3 kids, you have stress.
Yeah, I would define stress as an emotional, physical, mental state of strain, tension, resulting from demanding situations or circumstances, sometimes adverse circumstances.
And why is a little bit of stress, though, a good thing?
Oh, I think a little stress is that extra oomph to get you off the sofa, to go run that mile that you're supposed to go do, get that deadline done, get your kids' projects done, and help them with their homework. But it's that extra energy or that extra shot of caffeine.
Kind of spurs you on to be your best.
Yeah.
But isn't it just a part of our everyday lives, which is why people really just don't even bring it up?
It honestly is. There's a little bit of stress every day just to get you to get up in the morning. We all have alarm clocks. That's a little stress there because there's a time that you have to get up. So I think everybody has a little bit of stress just to get their usual activities done.
Do you think that there is a stigma around stress? People don't want to admit that they have too much stress in their lives?
That's probably true. People don't want to say, hey, I succumb to the pressure. Hey, I can't work under pressure because my colleague has pressure too. Why can't I deal with it? And I think a lot of us interview for new jobs and they kind of go, hey, how do you work under pressure? What do you do in a situation stressful like this? How do you handle it? So you want to be the one that says, I can handle it.
I can handle it. Yeah, because you feel like a failure if you say, well, no, I can't handle the stress.
Absolutely.
There was a recent Gallup poll which said that Americans are among the most stressed people in the world, and that they're more stressed now than they've been in the past 13 years. Yeah. That 55% of Americans say that they have a lot of stress during a lot of the day, and that's actually 20 points higher than the global average. What is it about us that makes us so much more stressed, or are we just more vocal about it?
I think we want to do a lot. We see other people do. We want our kids to succeed. We want to succeed. And then I think we're a lot more apt to admit that we have those stressors in our life or that pressure.
So we're more vocal than folks in other cultures around the world to say, we are stressed.
I think so.
So what ramps up stress? What are the triggers for it?
I mean, it could be personal illness. It could be illness in a loved one. It could be your job, your deadlines, just all everyday stuff.
And what about major life events such as divorce?
Absolutely. Divorce, getting a new job, losing your job, having to move because of a job or just moving for a good thing. Sometimes it could be good stressors, but it's still stressful.
They say that moving is one of the most stressful things that you can do in your life.
It does.
Changing your place of residence.
You have to take everything out of your house and bring it with you.
And then you have to purge too. And maybe try and get rid of the stuff. So what's the difference between normal stress and then bad stress?
I think the normal stressors are like what we discussed, just being able to get up in the morning, make sure your kids are fed, they're off to school, you get to work. Once it gets where one deadline after a deadline and you just can't keep up, you missed an appointment, you miss your kids' soccer, I think then it takes a physical and emotional toll out of you and you become super fatigued.
And so they say that stress kills. What can having too much stress do to you?
It can increase your blood pressure, which then you're at risk for cardiac disease. You might eat too much, then you're at risk for diabetes. It can cause depression, maybe even suicidal thoughts. I think all that would be on that chronic stress, and that's when you kind of go, this is a little bit more than just that acute stress reaction.
What about upset stomach, heartburn?
Absolutely. It goes from head to toe. You can, physically, you might break out with acne, you might lose your hair. Then you start having chest pain, palpitations. Then there you go with your stress ulcers. You might get diarrhea because your bowels are out of whack. Your back hurts. Just a lot of muscle tension.
I was going to say the tension where you're like this.
Tight.
Uh-huh.
Yeah.
And also sleeplessness?
Absolutely, because you're thinking about all your deadlines. Your mind keeps racing all night. There's no way you can get rest when your brain's not resting.
And then your brain is fatigued and then your body's fatigued?
That's right, because you wake up in the morning when your alarm goes off and you realize, gosh, I haven't even slept at all, or maybe an hour. There was a study a couple years back on patients who had high blood pressure. And if their stress led them to have severe depression, 48% of them actually ended up with a heart attack, what we call myocardial infarction. So had those patients sought out help earlier, that could have been prevented. So you're right, stress does kill.
So is there a timeline for when you say, look, this is actually too much stress, or these stressors in my life are lasting too long and it's leading to, constant anxiety or depression? I mean, when it becomes something that you really should go, wow, I need to sit up and take notice of this.
I think if it's going on for at least a couple months, maybe even a little bit longer, I think you look back and say, hey, how did the last couple months go? How did the last 3 months go? That's chronic stress right there.
And if your personality changes, let's just say you're stressed out, you're not really nice to be around.
No one wants to be around you, and you isolate yourself from other people because now you're trying to focus on trying to get things done. You're not laughing. You don't want to talk to anybody because you're just so irritable.
So that is one of the signs when you're too stressed that you say, actually, I really want to be alone. Just keep me away from people.
Yes. And they might drink or they might smoke. You might see a person start smoking or finding a different way to relieve that stress in a bad way.
And drinking too much alcohol to cope with it. In a couple of minutes, we want you to hold this thought. We're going to come back and talk about this, what you can actually do to lower stress in your body. We're going to give you some tips on how you can manage stress. How do you manage stress? Why don't you leave the comments below. And also, if you would like to assess your stress, just click on the link and you can take a stress quiz that we have for you. All right, so what are the warning signs, Dr. Lee, that you have too much stress in your life? What should be the bells and whistles going off?
You become super irritable, you're short-tempered. Maybe your family did something that's so benign and small, but your reaction to it was out of proportion to the situation. You're now feeling a lot of physical toll from that stress, especially that chest pain or that depression that makes you think about your life differently. Those would be warning signs, I would think.
And if you get those warning signs, what kind of help should you seek to help you manage your stress?
I think the first place you would go to is probably your doctor or maybe a counselor if a person's already in counseling. But they can even ask a friend, I suppose, and talk to a friend and see if that helps relieve any of their stress.
So it's the kind of thing is that you shouldn't keep quiet about. You should actually talk to somebody about it.
Absolutely.
And that would be your primary care physician, your internist, your family medicine doctor?
Yes.
It would not necessarily that you need to go see a psychologist right away.
Not right away. If you already are followed by one, then that'd be great. But I think your first point is always your PCP. When in doubt.
Primary care physician.
Yes. When in doubt, go to your primary care physician, ask them, listen, this is what I've seen. This has been happening for 3 months. This has caused me all these physical or emotional symptoms. What should I do? How can you help me?
Okay. We referenced this a couple of minutes ago. Let's come back to this now. What can you actually do to lower stress in your body? Why don't you give us some tips?
I think it's important to continue your regular exercise. If you like yoga, maybe Tai Chi, maybe meditation, all that would be good. I think what we alluded to previously was find a friend, that friend you haven't had coffee with for a while, and go out on a coffee date. Do stuff with your family. Do things to distract you from that stress. Read a book. My kids and I love music, so we'll turn on some music when things are there's just too many things, even if it's for 5 minutes. Or a lot of people here in San Diego have long commutes. They can, turn on an app or that music and kind of just find that half-hour commute or 45-minute commute. That's their relaxation time. And that's important to do.
What about deep breathing?
Deep breathing, yes.
We're going to do that in a couple of minutes, I think. We're going to have a little relaxation technique for you. Keeping a sense of humor?
Always keep a sense of humor. Laughter is always the best medicine.
And when you setting aside time for hobbies, such as you say reading a book or listening to music, how much time should you set aside each day to deal with the stress in your life?
It's always ideal, probably 20 to 30 minutes, but even if you had 10 minutes, it's amazing what 10 minutes would do.
I was going to say, there are people who are going to say, I don't have time in my life because I'm
Right.
too stressed. I have all these things I have to do. How could I possibly have time to do yoga or Tai Chi? What do you say to those folks?
You know, you can always make time. You make time to watch the football game, even if it's the fourth quarter. You make time to, you know, see the last parts of your kid's soccer game. You know, there's always time.
How do you manage stress? Let us know in the comments below. And once again, if you would like to assess your stress, just click on the link and take our stress quiz. All right, would you like to show everybody? You can actually manage stress right in your chair at work,
Yes.
correct?
Yes.
All right, let's show everybody how you can manage stress.
And this is helpful because we were talking about how people don't make time, but you just sit and you're just going to do these deep breathing exercises and stretch. So you're just going to make sure you breathe all the way in, open up those lungs, and out. And you're going to roll those shoulders back as you breathe in, and then out. And then let's put our hands together, palms out, give a good stretch, stretch those back muscles. Breathe in and out as you're pushing forward.
So
and you can
so it's kind of breathe in here and then push it out, full
yes.
breath, okay.
And you can actually do this overhead as well.
So it's
Yes. And out.
close your eyes too.
That would be.
Does it matter?
It doesn't matter, but I think it's a little bit more peaceful if you close your eyes.
So the breathing is really the most important thing.
Yes, and you're kind of just stopping everything, that adrenaline rush, all that epinephrine going around, you're just kind of going, just calm down a little bit.
And so you can do this at your desk while you're working on your computer all day long. How often should you do these kind of exercises?
Maybe 3 times a day, do 3 to 5 breaths each time. That's
So
all
that's
you need.
really, that's nothing.
Yeah, and if you have more time than that, then do it, do more of it. But it definitely stops that fast pace that just everything's going and just falling upon you.
So when you do that, what does it physically do to you?
I think it stops your heart from racing so fast, so it slows down that heart rate and likely that blood pressure
The blood pressure comes
that's
down.
just stemming in.
Okay, cool. Any final thoughts, doctor?
I think just make time for yourself. We all deserve it. You know?
A lot of people will say that that's very selfish. You know, I have so many other things I have to do. I have to take care of everybody else. And making time for me sounds like a very selfish thing. What do you say to that?
I think it would be more selfish if you let your body just erode badly as well.
Any final thoughts?
Nope, just keep laughing and keep breathing.
Okay, we'll do that, right? Thank you so much, Dr. Lee. We really appreciate it. If you'd like more information on how to manage stress, just click on the link or go to scripps.org/videos. Want more critical information on your health? We take care of you from head to toe. Please subscribe to our Scripps Health YouTube channel or follow us on social media at Scripps Health. I'm Susan Taylor. Thanks so much for joining us. It's our mission at Scripps to help you heal, enhance, even save your life.